people are already using the chat box. Thank you very much. For those who are just joining us, welcome. We are delighted to have you this afternoon. Please share with us who you are, where you are joining from today, and also share with us your job role and what you're already planning to support our NHS people during this winter that's just around the corner, and send that to all participants using the chat box. If you have a Twitter handle, please share it with us as well. We'll be tweeting right throughout this session, and we'd like to follow you or to add you onto the tweets we are sharing during this session today. So welcome, everybody. We are hoping to start dead on at 4 o'clock. So for those who are joining us, thank you very much. We usually have a few join us way before the time, which we are grateful for. Please use this time to just share with us who you are, where you're joining from today, your job role, and how you're already preparing for the winter, the support you are going to put into place for our NHS people in your areas, and send that to all participants using the chat box. I'm working from home today, so I'm joining you from Kent. I usually join these sessions from London, but today I'm joining from Kent, and I'm really, really looking forward to this session. It's been 4 weeks since we last had the last one, and I'm looking forward to sharing with all of you and also learning from you in terms of what you're doing, supporting our NHS people where you are. So welcome, everybody. As you join, use the chat box and share with us your name, and also share with us where you're joining from and your job role. Thank you. I'd also like to welcome those who are joining us on the YouTube. We'll also be running this we'll be live on YouTube as well. So welcome to all those who are joining us on YouTube. We are delighted to have you this afternoon. We have a good number of colleagues who've already joined us. So thank you, everybody who has just joined, and welcome. As you join, please share with us who you are, where you're joining from today. Share with us what your job role is, and also some of those things you may already have put into place to support our NHS people in readiness for winter. And send that to all the participants using the chat box that we have. If you're on Twitter, please share with us your Twitter handle as well, and we will share that throughout the session. We'll be tweeting, and we'll share what the sessions today and the key points from today's session. We have been building a well-being community through these sessions, and we have it on screen at the moment in terms of, how we keep connecting with each other, even outside of the sessions we have today. So the details are on screen now in terms of, following up and joining and sharing the practice, good practice of what you're doing to support your colleagues. We have those details showing up on the screen. So please do make a note of that if you've not already joined our well-being community. We'd love to hear from you and also to continue keeping in touch with you. And it's also the repository where we have all those health and well-being initiatives that we keep on sharing through these sessions. So welcome everybody to, I'll just go back to that screen. Thank you. Yeah, that slide. Thank you very much. So for those who are still joining the sessions, welcome. And please, as you join, use the chat box to share with us who you are, where you're joining from today, your job role, and also what you may already have put into place to support our colleagues during winter, and share that with all the participants using the chat box. Thank you.
Thanks, Elizabeth. So we've got Jo Smith is Health and Wellbeing Lead at LSCFT. We've got Terry. Hello, Terry, from the Leadership Academy. Julie Luscombe's just joined us, Head of Education, Jersey Hospice. Hello, hello. We've got a few people sharing their Twitter handles, which is great. We've got our colleague Lee Kendall is on Twitter today. She's going to be live tweeting. So please do share your thoughts throughout the session on Twitter as well, using the hashtag #CaringForNHSPeople. Welcome. Please do keep using the chat room throughout the session, as we will be pulling lots of questions out of there for our presenters today. And we've got Sarah, hello, team lead with integrated discharge service at North Bristol. Fantastic, welcome everybody. So please do keep sharing throughout the session your thoughts, your comments, your questions, and tell us what you're thinking, what you're feeling. Hello Jane, we've got Jane, Deputy Director of Workforce at the Walton Centre in Liverpool. Another Zoe, Organisational Development Lead at Leeds CCG. Welcome. I can see the numbers are coming in thick and fast as the session is just about to start. And yes, thanks Helen. So we've got a good crowd on YouTube as well. So if you're not joining through Zoom, welcome to everybody who's currently on YouTube. So please do use the chat box in YouTube as well. And we've got some chat box monitors in YouTube who will be bringing your thoughts, your comments through to the conversation here in Zoom as well. So welcome everybody. My name is Zoe Lord. I'm Deputy Director of the Horizons team, and we're doing this in partnership with the People Directorate in NHS England and Improvement. We've got a really important session today. It's all about planning for winter and preparing our NHS people for the winter that we have ahead. We've got a fantastic session ahead. We've got 2 award-winning teams, and we've got a fantastic opportunity to hear more and be involved in a network in which we can support our NHS and health and care colleagues. So find out more about that later on in the programme today. Welcome to anybody if this is your first session with us. This is actually our 16th session, and the aims of today are all about offering support, ideas, knowledge and wisdom to those in a role supporting the health and well-being of our very important health and care staff. We're here to share a range of wellbeing activities, which our colleague Steve Lee will be sharing with us today, and lots of opportunities to connect with each other as well. As I said, this is our 16th session. I thought I might share with you some of the engagement that we've had today, and I just think some of these numbers are absolutely phenomenal. So we've had over 110,000 views of the sessions and the materials. We've had 31 million impressions on Caring for NHS People on Twitter. Thousands and thousands of words shared in the chat box, and if you're thinking who reads them, we all read them. So everything that you write in the chat box in YouTube and in Zoom. It all gets read. So please, please, please do keep using the chat box throughout the session to share your thoughts. If you've got any ideas or inspiration, then please do add it to the chat box. And you can see that we've got a newsletter, and we'll put the links to the newsletter. It's on our website, and we'll put those in the chat box as well. And we've got our Tribe platform as well. So lots of great stats, of which lots and lots of really good information from the team has been shared. Elizabeth, over to you.
Thank you, Zoe. On our agenda today, of course, you've already met me and Zoe. We are your facilitators today, and we will get to hear about an update on the national support offer. This is something we've been sharing with you throughout, and we will hear from Steve Lee, who will provide that for us today. And then we will hear from the award-winning Wellbeing Initiative team, led by Rafaela Goodby, Owen, and Mike. And we will have some reflections from Professor M. Wilkinson Bryce. And we will also have a session about forming a national network to support our NHS people to thrive during winter. And Jacqueline Davis will share that with us. And as usual, we always end these sessions with a call to action and some closing remarks from me and Zoe. And on the team today, you've got me and Zoe facilitating. Our contributors, we've got Steve, M, Rafaela, Owen, Mike, and Jacqueline. Behind the scenes supporting this session, we've got Paul Woodley, who is our technical host. And on the chat box, we've got Karen and Louise. On YouTube, we have Ian and Lindsay. And on social media, we've got Lee. Thank you and welcome. And to kick us off, we are going to hear about an update on the National Wellbeing Offer. And we'll hear this from Steve Lee, who is the Interim Head of Health and Wellbeing in the People Directorate team, NHS England and Improvement. Previously, Dr. Sonia Wallbank has been providing the sessions for us. Sonia has moved on to a really exciting new role. She is still contactable, and if you need to contact Dr. Sonia Wallbank, please do so through Zoe. But for now, over to you, Steve. Welcome.
Thank you very much, and thanks for such a warm welcome. I know Sonia's a hard act to follow, so I'm going to give you an update of where we've got to at the moment, and what I'll share with you is an initial evaluation of the offer, well, some key components of the offer, and some of the work that we're going to be taking forward in the near future. If I could get the next slide, please. So we spoke earlier about the numbers of people that we've kind of reached through these sessions, but just to give you an idea of number of people who are accessing the offer, the website in particular is very popular, close to 300,000 users there. The helplines have proved popular, as have our apps. Leadership circles as well, where people kind of get together and discuss key issues. Our common rooms, where people can talk about work-related issues, be that from a group or be it from an individual characteristic. So, for example, if you're BAME, you can join the common rooms, talk about areas of concern for you. We've had primary care coaching sessions and a number of webinars too, where people can come along, find out all what's going on, and also ask us questions and give us feedback about what's working and what we may need to refine. If I could get the next slide, please. Just to give you an overview of the feedback that we've received, and I promise you the sample size isn't just the health and wellbeing team here, so, you know, because the confidence levels that we've got back are overwhelmingly positive. So it varies in terms of the sample sizes here, depending on the size of the offer and the service. But we've typically got views from between 200 and 3,000 people on the services that we've been providing. Overwhelmingly positive feedback, and we will keep going on that. If we could go on to the next slide, because it's not just the kind of the numbers, it's also kind of what the data is telling us. Number of people have been contacting the helplines. To get behind the numbers as well, we're able to drill down about what the nature of the calls are about. So some of them could be about primary stressors, about things that are affecting people directly at work. But we're picking up as well issues around secondary stressors, things like financial concerns, things like relationships issues, And we have provided a response to that. We're holding webinars on financial support, for example, together with the Monetary Advisory Service. The Shout text helpline has been really helpful for people because of the ease of use and ease of access. People are reporting a number of mental health issues, and we're ensuring that they are getting directed to the right interventions for them. The Hospice UK bereavement helpline, a number of calls there. We anticipate the need for that will rise, but we have got funding for an additional year, and we will keep all of these under review. If I could get the next slide, please. About our apps, incredibly good uptake. We're really encouraged by that. We're really keen that the users of those apps also tell their colleagues about the usefulness that they've had. Just to say as well, nothing I'm presenting to you is a substitute for good line management conversations and peer support, but they're additional kind of resources and additional things that staff can go to. So if you're a line manager and you're stuck or you don't know where to direct people, these are the signposts where you can direct people to. So again, kind of it's the data, the numbers are really, really encouraging, but we're also seeing, who's accessing the offers. And it's encouraging to see that as well, that we are getting a good spread of people uptaking the offer. Recovery rates really positive around the Sleepio app that we've got. So all in all, taken as a whole, kind of we're getting confident that the offer that's out there at the moment is resonating. People are using it. We're just keen that continues to grow, and we're keen to continue to ensure that our communications are right, so this gets to the users as and when it's needed. If I could get the next slide, please. I wanted to just pause on this really, because I've spoken quite a lot about the numbers in terms of people who are accessing the service. But I'm just going to leave you for a moment. This is from our text back service, the first quote there. And I'd just like to pause just for a moment for you to read that. So that for the team, it motivates us, encourages us to carry on, because we're making an impact on lives, not just working lives, but people's whole lives. And gathering that qualitative data is something that we're really keen to do. Some people really like the numbers, and that encourages uptake. Other people really like the stories and the impact that this is having on people. If I could get the final slide, please. So what's next? Well, we'll continue to collect and review data on the current offer, on new offers, and responding to need. We will listen to the intelligence. We will kind of respond to what's out there. We have groups that are set up with the academic community and other professional bodies who can help ensure that the offer that we're providing is evidence-based and will resonate. But we're really keen to hear from people as well, from users, to let us know, is this working? We're driving work forward across the whole of the health and wellbeing agenda. So we're doing work, for example, on body-worn cameras for ambulance personnel, because we're getting intelligence that incidents could be increasing, and our work on civility and respect. Everything that we do on health and wellbeing, from the primary prevention work that we do to ensure that ill health, we don't have any ill health consequences on staff, through to that support offer that we've had a focus on in the recent past and we will have in the near future, is all connected and it all comes together. Additional evaluation activities are underway, and we'll keep an eye on those. We're working with the Samaritans volunteers too, to see what's happening and to see what that data is telling us. We anticipate that these activities and everything that we're doing combined as part of that whole health and wellbeing package will encourage people to access the offer, to use it, and to ensure that health and wellbeing is held in the regard that it is, that it's continued on the agenda, and those conversations happen as a matter of routine. I hope that's been helpful, and thank you again for inviting me along, and back over to Elizabeth. Thank you.
Thank you very much, Steve. Just listening to you there and seeing the data on the screen, it is just staggering, the number of uptake that we've had during this time. So a big thank you to you and team. I know as one of those people working on the ground, we've shared all the support to our staff across our organizations, and it has really, really been useful in adding to what we could possibly provide ourselves within our own organizations. So massive thank you to you and team. So we're now going to hear from a team who will share with us their Wellbeing initiative. It's an award-winning Wellbeing initiative. And just before I welcome the team, I'd like to just offer my personal congratulations to Rafaela Goodby, who very recently, I think it's in last week, was awarded the HR Director of the Year award from HPMA Awards and HPMA Community. Congratulations, Rafaela, very well deserved. And I'm now going to hand over to you and your team to share with us your Wellbeing initiative. Thank you. Over to you, Rafaela.
Thank you so much. Thank you, Elizabeth. Thank you for the congratulations. And I think when I accepted the award last week, I wanted to celebrate the work of everybody who works within HR, within the whole of the NHS. I think it's really brought our contribution to the fore. And that's something that we want to talk about today and share some of those experiences. We won an award at HPMA as well for our work on junior doctor wellbeing in particular, which is what we're going to talk about today. We could talk all day, couldn't we, about wellbeing, 16 seminars, and we're still going. Today on our seminar is going to be myself and then Dr. Mike Blaber, who works for our organisation, Sandwell and West Birmingham, is Junior Doctor Pastoral Lead, and Dr. Owen Dorr, who's the Chair of the Junior Doctor Forum and is currently an ST anaesthetics trainee in Frimley. And I also want to mention Dr. Saab Clare, who was she's our Deputy Medical Director and also a leader of this work. She was awarded an MBE on Sunday, so we're mega, mega proud of her. And then also Alison Eastaugh, who was critical in this work, who's our Chief Registrar and has now handed over to our new Chief Registrar, which we're going to talk a little bit about sustaining that. So my input to this presentation and my input as HR Director to this piece of work has been to remove barriers, to get out of the way, but also to be the go-to person to help integrate the work that's going on and the ideas into the corporate governance and the bureaucracy and committees and the various things that we have in organisations, which if you think about a hard to reach group like our junior doctors who are maybe with our organisations for a year or for 2 years, living away from home, living away from their families and starting again, having their first days at work every couple of years, actually it really helps to have somebody who is the connectivity into the board and into the machinations of an organisation. So that's been my role, and my role has been to move things out of the way. And I think if we're talking about preparing for winter, HR directors or HR teams don't need to have all the ideas. The ideas are already out there with our clinical professional leaders and corporate leaders. I think what we need to do is find ways to listen to them, which is what we're going to talk about today. So I'm going to hand over to Dr. Mike Blaber, who's in my office with me, but we are sitting in a socially distanced way. I'm going to angle the screen over to him and hand over to Mike.
Hi everyone, yeah, really great to be with you. Well, we just want to set the scene really about junior doctor wellbeing nationally before we move on any further. The NHS staff survey in 2018 showed that nearly 40% of doctors in training had been unwell in the previous 12 months due to work-related stress. In fact, nearly half of doctors are considering leaving the organisation they work for because of a sense of the loss of well-being. And it has been suggested that burnout is contagious, that once certain members of the team start becoming burnt out, then it can just pass on. And so we know that this has been a very significant problem that's needed to be addressed, and it's been given increasing attention as a result. Owen, if you move to the next animation, conversely, what we do know is that the organisations that invest in the well-being of their staff correlate with improved quality of care for patients, improved patient safety, the organisational productivity and financial performance is better, staff want to keep working and coming back at later dates too. So it's in everyone's interest for us to be looking after those who are working within our institutions very well. Owen, can we move on to the next slide, please? So you'll see on your screen 3 national reports which have been released in the last 18 months or to 2 years, and they have informed much of the work that we've done at SWBH. each of them suggesting how we can make our places of work sustainable for those who work within them to ensure that their well-being is accommodated. And from those national reports, we devised a strategy which formed the focus for all of the different initiatives that we're going to share with you today. Next slide, please, Owen. So this is the strategy for the SWBH wellbeing initiatives. Firstly, we wanted to recognise that we all have ordinary human needs as healthcare professionals, and that those needs cannot be safely ignored but need to be met. And so we'll explain really how we've done that in the coming slides. We also wanted to create a culture of connection. We recognise that over recent years and recent decades, in fact, working in the NHS has been more and more of an isolated experience where people can feel like they're a name on a rota who's not really known. And we wanted people who work within our trust to feel known and valued and connected to others who they're working alongside. Thirdly, we wanted to enhance awareness about wellbeing so as to provide the necessary means for people to be able to cultivate well-being in their daily life. And so that's about education and signposting well. And then thirdly, we wanted to really create a culture of caring for carers in order to be able to deliver compassionate care. Those who are working in our institutions need themselves to receive compassion. Compassion passes on. And so we wanted to make sure that we were creating an environment where that was happening. I'm now going to pass over to Owen, who's going to talk to you about some of the practicalities of how this strategy was outworked in our trust.
Fantastic, thank you very much, Mike. So I'm Owen, as previously mentioned, I'm an Essex trainee, but was involved in the wellbeing side at Sandwell, West Birmingham. I think wellbeing gets a bit of a tough remix. It's got such a broad definition. But I think for this project, we really looked at, actually, if we look at our staff's energy, performance and mental optimization, actually that can really create some really tangible change. And so dividing it up and coming up with kind of smaller targets and asking people what they want on the front line really led some excellent results. So I think a phrase that kind of gets used a lot, actually we're saying that we're heroes or whatever. Actually we're not. We're ordinary humans trying to do extraordinary things, and because of that we need to kind of look after ourselves as ordinary humans, and that involves looking at the areas that cause the most fatigue. And from our cohort, the things that came out were people having disrupted sleep patterns, not taking breaks, and then just not eating correctly. I think as a night shift worker, when you're up for 18 hours, you're at the drink drive reaction speed limit. And if you can think about a way to look after yourself and be able to get some rest during that night shift, you can really benefit patients as you improve your performance by looking after yourself. One of the main things we did with that in tow was creating these areas of psychological safety and creating dedicated common rooms that had rest facilities, had places where you could take your break and have get some decent nutrition in. And considering it went from a place that you could only rest in your junior doctor's office, either on the an uncomfortable chair, to a place where people could go mix and look after themselves, we really started looking after people's ordinary human needs. I think part of that was having a sleep project where we in the AMU were able to, acute medical unit, were able to get a dedicated room where we put a sleep pod in. This is an advert, I'm not affiliated with sleep pods, but it just allowed somewhere where you could go switch off and get yourself down from red to amber or amber to green and just have a 20-minute power rest. And they're particularly useful because you could use them during the day after a cardiac arrest and able to switch off from that. The other thing was having a culture of connection. So we developed something called the 3 Squares Club, where it was based on looking after yourself and getting 3 square meals a day. During COVID, we expanded that out so that we had sessions for peer support on Monday morning after night shifts, afternoon for long days, and then had that on Wednesday and Friday. It's around about 12 sessions, and that was essentially meant to be kind of a coffee shop atmosphere where you could go. There would be a facilitator who would be a Mike's, people such as Mike, pastoral care leads, down to me, who was just someone who's very interested in well-being, and just have a chat and be able to get some themes out and kind of share your experience. And then if someone was triggered to be seen to be feeling very low, then and in the red, then the peer facilitator would know about the resources that they can access. So it increased accessibility for junior doctors, and that was spread out as well and taken up by our nursing colleagues, who also incorporated that into the local huddles, just asking people how they are and getting that connection going and making you feel as if you're supported by your peers. The other area that we looked at was how we could get the message across. There's a lot of good evidence for how you can look after yourself and what you could do. So we put that all together in a wellbeing document that's designed by 2 of my colleagues, and got that was easily accessible by the Trust homepage. We did some wellbeing videos, which if we put about on Twitter, and they were only 2 minutes long, and they came up in the Trust intranet. But they just started that conversation up on the various topics of how you can look after yourself, how you can look after colleagues, and just kind of got the ball rolling that way. And in those, we always included a signposting tool so people knew where to go if they felt they really needed some help there and then. The next thing was kind of how we looked after the people who were looking after us, so to speak. I think one of the main things that we have in here is the role of pastoral care leads, which is something that we set up at Salmon West Birmingham from the Junior Doctors Forum. And it's important to say that you have someone to go to that isn't directly aligned, especially for junior doctors, with your career progression. If you're a surgeon who's about to qualify, you might be less likely to go and see someone who's about to offer your job about depression, and therefore you might not access any support at all. So having someone local that you can go to who can be completely confidential decreases those barriers to getting help. And we really at Salmon West Birmingham benefited from having Mike, especially during COVID, and the amount of people who've walked through his door and had a cup of tea with him and used him as support is amazing. We also were able to have a very good induction to get the program running for people, to make sure that they know that wellbeing is top of our agenda. We've been liaising with people outside of our program in kind of clinical educators and deanery wide to try and get the program we've come up with out there. And we've also spread things trust-wide, such as wellbeing packs for everyone in staff, including Vijay through fundraise for it, who's pictured here. And that was really well received, and we'll be releasing some press on that later. So hopefully those 4 domains that we looked for small, tangible achievements in each, and went on from there. And it's led to some really good successes and something I'm really proud of with the team. And so back on to Mike.
Thanks very much, Owen. So we did a QIP project with all of this activity, and there was lots and lots of data that we could share with you, but obviously time is short, so we just thought we'd share 1 or 2 headlines. We asked our junior doctor cohort in March, just before COVID kicked in a big way, how supportive they felt that SWBH was to their well-being, and 65% thought that generally SWBH was supportive. Following all the initiatives that have just been described, we asked them again, the same cohort, and 88% felt that actually SWBH is supportive of their well-being, and over 70% said that the initiatives that we had undertaken in that period had a positive impact on their experience. In fact, we'll share with you some of the comments that were made by some of the trainees. Owen, can you come to the next slide, please? So we were really encouraged to hear trainees saying things like they would prioritise coming back to the trust in the future because of the emphasis on well-being, people feeling that they were able to perform to their maximum because their well-being was taken care of and was valued. People suggesting that coming to work was a highlight in the pandemic, which was again something that we were really glad to read, and that was largely because of the sense of community and of morale that existed. Of course, there's still further for us to go, and we recognise that we have started something which must not be rolled back having been rolled out, but rather needs to be built upon to be taken further. And we're all committed to doing that together, so that those 4 building blocks continue to grow and to develop as we make wellbeing a priority in the trust to enable us to be able to deliver excellent care to our patients. I'm going to hand back to Rafaela now, who's just going to wrap up as we look about going forward.
Thanks, Mike, and thanks, Owen, as well. So we've given you a whistle-stop tour, really, to the past 6 months, and in particular to how we've engaged a typically hard-to-reach group with the junior doctors. So there's a number of things that we're going to do next. So, Owen, if you just go on to the last slide, and I know that there will be lots of questions, and happy to have conversations with anybody afterwards. So Mike, who you've just heard from, is our pastoral lead for junior doctors. So we had a proof of concept where some of the MERPS funding from our juniors was used to fund Mike's role for 12 months, but we've now extended that as a trust because it's been so critical and had such a big impact, as you can see from the data. And what I want to focus on, and what we've been working on in the past couple of months, is making sure that everything that has been put in place doesn't now get lost as you get junior doctors rotating. So having Mike in post is part of that, but also really integrating everything that we've done into the committee structure, into having an exec leader, into how we are managing wellbeing and planning for COVID surge 2 and for winter. And so there's lots of training, there's lots of check-ins. So we have a whole programme of support that we want to continue, but I'll stop talking so that you can ask some questions, because we're probably over time. It's been a privilege to work with the clinicians and the professionals that we have done in the past year, and I think the energy of different people coming together, we'd already started to lay the foundation of a number of these initiatives before COVID hit, which meant that we were in a good position to be able to respond in a very quick way. So thank you to everyone who was involved in it. Thank you, Owen, thank you, Alison, thank you, Mike, and we're happy to answer any questions at all that you have.
Thank you very much, Rafaela, Owen and Mike. Thank you for sharing that initiative with us. We have lots of, looking at the chat box, there are lots of questions there, lots of comments. Really, really important to remind us that if our staff are well, then we know they will be out there and do their very best in supporting and looking after our patients. So before we come back to you for questions, I'll be coming to you, Louise and Karen, in the chat box. But before that, I'm just going to invite Em to share with us some reflections before we head on to the questions and the comments in the chat box. Over to you, Em.
Hi, thank you very much. And gosh, what a lot of content to reflect on. Hello everyone, my name is Emma Wilkinson-Bryce. I'm the Deputy Chief People Officer at NHS England, NHS Improvement. Been in the role for a year, 30 previous years as a nurse predominantly, and Deputy Chief Exec. So really great to have the privilege of being the SRO for the National COVID Staff Health and Wellbeing Programme. So I've got 10 points, so I'm going to whistle through them as I was listening to what the team was saying. So the first one was that actually what you talked about, Rafaela, was about moving things out the way. And I just think actually we've seen that in spades across the pandemic, that actually a lot of people are talking about the fact that people have collapsed things that didn't add value, that didn't, that got in the way. And we've allowed people maybe to do the right thing. And I think there's something really important in that for all of us about let's not go back to some of the way things were previously. I loved the phrase burnout is contagious, but I wanted to counter it with maybe we could say treasuring our people is infectious. And maybe that's what we need to really focus on through our health and wellbeing work, is that the infectious nature of treasuring our people and valuing what they do really keeps us very honest in terms of our endeavours around health and wellbeing. We've talked before on these seminars about bringing our whole self to work and how important that is. And I guess what I also reflect is that it's very personal. What's right for one person won't be right for somebody else. So what we must try and do is create lots of different opportunities for people, because when somebody wants to seek help, support, then help's got to be there, and it's got to be the help they want, and in a way that they want to access it. So you talked about partnerships, and very clearly a partnership approach that's worked in this trust. I think increasingly, when I look around the country at where things have been really amazing in terms of health and wellbeing, it is because people have come together in a partnership way to really celebrate individual talents, uniqueness, bring it all together and create something really magical for staff. Use of language. We've had, again, on these seminars, another conversation about the use of the language around heroes. We have to normalise seeking help. And if we keep talking about everybody being heroic, it's sort of great against that notion of, you know, do heroes need help? Well, of course, you know, nobody's a hero, actually. And I loved what Owen said about, you know, we're ordinary humans doing extraordinary things. And actually, you know, this sort of analogy of heroes and heroics isn't helpful. So how do we make sure we're really mindful with our language, I guess, so that we're promoting the right culture around health and well-being, and like I say, that we want to normalise people feeling able to ask for help. Quite a lot of what you talked about was about spaces, either psychological spaces or physical spaces, and I just think increasingly, when we've put together the national offer, we've talked a lot about where do you reflect, where do you have time out of this crazy world to actually just process some of what people have experienced, and also very practical things like where do you go to get a cup of tea, where do you get to actually you know, I can remember many a shift where actually you sort of got to the end of the shift wondering whether your kidneys were going to work properly because you hadn't had a drink and you probably hadn't gone to the toilet either. So, you know, some real practical human aspects that are just so important. And then I guess the value statement about health and well-being is that if you're working in an organisation that values your health and well-being, it really says that they value you and value your contribution. And I think what you really underscored for me was just how important it is at every level through an organisation. So yes, the chief executive needs to get behind this, but so does the line manager, so does the supervisor, so does the team that you're working in. And if we are going to really treasure our people, then we've got to really put our shoulders behind this wheel beyond COVID, and that's certainly some of the commitment that I'm making to why I want to keep doing the job I'm doing. So really great presentation, no surprise that it was award winning, and actually something for everybody in there, I thought, to take away, hopefully. So Elizabeth, let's open up to some questions.
Thank you very much, Em. I think the first question is to you. Lots of chat there and people asking us if you can share with us just very briefly about the national award that the team recently won.
Yes, so we did win the national award, which was Personnel Today, I think, and it was for the programme. And I think it was partly because of how quickly the programme was stood up. So within 3 weeks, that was put in place, and I guess the fact that it's still growing. And I put in the chat box up at the beginning that we, you know, myself, the team, we're scanning constantly to say what do we need to do more. How do we need to develop the programme more to respond to specific needs in our workforce? You know, there's 1.4 million people that work in the NHS. How do we make sure that we anticipate and predict and respond to pressure as it emerges? So it was a really great surprise. You don't do this stuff to win awards, but for the team, it was really great because they've worked really, really hard. So yeah, sometimes I think, having come into the centre, and when people said to me you'd gone to the dark side, even the dark side now and again need to have a little bit of praise, and so they definitely deserve the praise that award gave them.
Yeah, thank you very much, Em. There are lots and lots of questions in the chat box, so I'm going to go to my colleagues Karen and Louise. I'll begin with you, Karen. If you can share with us the questions coming out of the chat box, maybe just one or two for our panel, and then I'll come to you, Louise, to share the same. Over to you, Karen.
Thanks. There's loads of comments and really great questions. I think everyone's really enjoyed the presentation and hearing about the strategy. It's fantastic to hear about all the initiatives. A couple of the questions have focused particularly on the training available for the pastoral role. So what was training available for the trust, but also could that be a national framework?
Yeah, hi. So I think the Wellbeing Champion role is a new role that's being kind of introduced kind of more nationally. So there isn't kind of formal nationalised training that's available for it. We work very closely with the occupational health department here to make sure that we're having a joined up and coordinated approach to things. And in the past, I've done a set of a wellbeing programme for FY1 doctors starting in the region. But HEE have produced some guidance for wellness champions. So if you typed into Google HEE wellness champions, then you would get a document that lists some guidance for how to conduct some wellbeing check-ins with staff. And also that there's some training that can be made available from them. So that would be one avenue.
Over to you, Louise. What's coming up from the chat box?
Thanks, Elizabeth. What I do love about the chat box in these sessions is that people are sharing tips, they're jumping in there. You know, Raphael has been doing a fantastic job of answering a lot of the questions, so well done. And lots of people loving that phrase, treasuring our people is infectious. So loving that one, Em. In terms of questions, there were a couple about that have already been answered around the doctor. So I'm going to jump to one that came in quite early from Max, asking for tips around working from home and staying well and looking after your well-being when you're working in a home environment.
So let me just have a quick go at that one. So I think it's worrying for me that there are an awful lot of people who are home working who take great strength and comfort from being part of a team, and therefore it must feel really, really isolating. I think one of the things that I'm really keen that we do is we're doing some work with Invictus Games because they create virtual sports communities with their injured personnel who have served in the military. And actually it's been really interesting, that conversation about as the nights get longer and the days get shorter, a lot of what has helped people throughout the summer has been being in nature, going out for walks, that sort of thing. So if that's going to be difficult, how do we create something different for people so they can still connect virtually, still keep that exercise focus, but also just things like people have talked about buddies, people have talked about having somebody who's checking in on them, and having virtual coffees. I've made a commitment that every week I am having at least 3 virtual coffees with somebody from the team who I might not, you know, what I miss is when you're in an office environment, you bump into people, or when you're in a hospital, you bump into people. How do we create a bumping into each other that's different? Because it's often that sort of opportunistic contact that creates a conversation and you find out a bit more about somebody.
Thank you very much. And I've got one question for Rafaela. You talked earlier on about just enabling these initiatives to prosper and breaking down those barriers. Any tips for doing that? Anything you can share with us?
I'm not sure if I have tips really. I think listening, because I don't have all the answers. I don't know what it's like to be a junior doctor, or to go into critical care and lose 17 patients in one day when you've never lost a patient before, or used to working in a different area. So I can have empathy for that, and I know that that would be tough. But the people who really can make the difference are the clinicians themselves, and in this case the junior doctors. So and I think where I helped in this project was to move out the barriers of, do we need to do a business case for that? What committee does it need to go to for approval? How can we communicate it? How do we get things in internal comms? So the things were happening already in the ideas, but I helped make them happen because I understand the gubbins of the corporate governance of an organisation, whereas you can't expect someone who's on the front line looking after the patient in that moment to be able to do that. So we set up, for example, a shared WhatsApp group where we were sharing ideas and being very responsive as well to the people when they're actually, here's what will make a difference tomorrow, here's what we need for this afternoon, and being responsive in that way, and also directing my team and resources to make sure that the impact is getting to the right place and it's not what I think it should be and actually what would make a difference. So I think we've got 2 ears and 1 mouth, haven't we? So we use them in that order, hopefully, and listen to what would make a difference from the people who are actually doing the work.
Okay. Thank you very much, Rafaela, and thank you to all our panel members today. Lots to take on board there, and please continue sharing using the chat box. And I'm now going to hand you over to Zoe for the next session. Over to you, Zoe.
Thanks, Elizabeth, and team as well. I didn't even get time to ask my own questions, so I'll be putting those in the chat box, and I'll be encouraging Rafaela, Michael and Owen to be answering those in the chat box as well. I'd like to introduce Jacqueline Davies to us. So Jacqueline's joined us before. Jacqueline's the Director of Leadership Development and Lifelong Learning in NHS England and Improvement. And Jacqueline's going to be talking about a national network to support our NHS people to thrive this winter. Over to you, Jacqueline.
Thanks, Zoe. Hi, everybody. Just before I get into that, I wanted to give the community here some unusual facts. And I found this quite interesting in listening to the discussion that we've just had. So the demand for leadership and leadership education has grown exponentially through Wave 1. We've been really surprised. We've been really surprised by this because we thought everybody else was otherwise engaged and doing all the things that we've just heard about. But we've got stories where we've got 15% increase in terms of applications to our academy programs. We've seen Edward Jenner, which is our major blended first line manager offer, growing between March and September from 3,500 enrolments to 14,500 enrolments. And we're seeing this trend across the board. And we think this is pretty interesting. We've done a number of surveys during the summer to get underneath kind of what's going on. And what we're finding is that COVID is unleashing appetite and interest in kind of getting hold of ideas, tools, research around anything people can get their hands on, basically, to help them thrive and survive in crisis. So my team and I have been kind of looking at this and asking ourselves the challenging question is what needs to happen with the work that we do to completely turn ourselves inside out and think about how can we reach the people who need this most during winter. So this is the question that's foremost in my mind that I want to engage the conversation here in today. A couple of things we've tried. So some of you will have seen the Executive Suite, which we launched in September. This is our first toe dipping exercise into the world where we take resources closer to people rather than wait for them to apply on courses. That Executive Suite offer now, if you haven't seen it already, it's for senior leaders. And it's focused on helping to support them through crisis. So you can access mentoring support, coaching support, and also just general action learning sets and specialist activities through that. We've got 31,000 users now of that site, which isn't bad going for the last 8 weeks. And also what we've been looking at is how people are consuming leadership education. And one of the things that kind of stopped us in our tracks, I think it's helpful for everyone to hear this here, in the survey that we did, which had almost 5,000 responses, we could see that there are huge barriers to access through different demographic lenses, big barriers to access from our BAME community colleagues, but also we are hearing really loud and clear that those who identify with disabilities are struggling to access our tools and techniques over and above like 50% more than those who don't identify as disabled. So we're thinking very carefully about tools and techniques. And so one of the ideas that we're exploring now, in addition to technology, is how can we reach into the system and tap into all of the great informal networks that are out there that we know are there. And we're toying with the idea of two ideas, actually. First of all, the idea of almost like leadership lifeguards. Yeah, so who would be the people you would turn to when you needed rebooting, when you needed a piece of advice or a tool or a technique to help you as a line manager, help yourself. And in particular, and this is a point that we've also learned from Wave 1, how can you keep your team well? So we've just heard the story of how important relationships and connections are. Yeah, we're seeing in this appetite for leadership more and more demand for how can we create healthy teams? How can we keep our teams connected? Because actually a connected team keeps the individuals in that team going through difficult times. And so we're thinking about this idea of leadership lifeguards. We're thinking about which national network we partner with and collaborate with, and sort of almost create super users, people who are more able to understand what really helps in difficult situations, able to refer and almost triage leaders who are a bit exhausted, a bit out of, kind of out of kilter and need kind of putting on track. So this is one idea we're looking at. And related to this idea, we're also thinking about what if we could take the resources closer to the people that need them. In our surveys, we learned that 80% of people now want to access our education offers through mobile, and interestingly, through mobile in personal time. Yeah. And we're also learning people have had enough, understandably. I've seen lots of nods on this, of screens. Yeah. So actually, what could we do with audio? What could we do with podcasts? We've got to move fast. We've got to move fast on this. And we're going to need your advice and your support on how best we do this. And so really, I just wanted to open up the conversation, Zoe, if I may, to the chat box and the colleagues here to ask for their observations about what I've just said. And what resources would they think that they're going to need to get through either technology or through the network of leadership lifeguards, which is, by the way, a working title. And what else should we be thinking about?
Thanks, Jacqueline. So I'll just put the question on the screen, but please do share in the chat box of both YouTube and Zoom your ideas, your thoughts on what Jacqueline's just said, and what are the knowledge, what knowledge, resources or support do you need, for yourself and for others to thrive during winter. So we've got a few comments coming on already. Jay Luscombe, I think that's Julie. Love the idea of leadership lifeguards. There's quite a few people saying that like the idea of podcasts. Penny and Zoe have been talking about podcasts is good.
I don't want to get everybody too excited, Zoe, but I actually had a conversation this afternoon. It's one of those conversations you go, oh, well, you probably shouldn't say anything until it really happens. But if we think of some of the major names in the game who offer sort of listening, audio downloads, music downloads, can help us with curated content on things that can, first of all, kind of do two things. Actually, the sweet spot we're looking for is help people relax, help people have good downtime, but also keep the education going at the same time as well. I think the thing that we've learned in my part of the world during COVID is that well-being and education are not two different things. They're exactly the same. They can happen simultaneously at the same time. And in fact, actually, I know a number of people will know in Wave 1 we switched off the Leadership Academy, and we've been thinking long and hard about this for Wave 2. And we're certainly no intention at the moment to switch off the academy, but we're thinking about how we deliver things differently. Yeah, because leadership saves lives, and leadership is essential for keeping people well and our teams well.
So there's lots of ideas, Jacqueline, coming through the chat box. What I'd like to hear a little bit more about through the chat box is, what do you need? What do you think your staff need? Em spoke about this award that the national team have got, and that was really, there was many things that we developed from ideas that came out of this chat box for the offers and the support that was required. So please do put your thoughts, whether however small or big you think it is, please add it. We do listen, we do read everything, as I said before, so please do keep those coming.
And I think, Zoe, the other thing I just want to underline on this is the importance of teams. We've noticed, certainly from our perspective, that we've got a bit of a gap in terms of our offer around teams. And we know that there'll be all sorts of teaming activity going on during winter. There'll be the intact teams and the well-established teams. There'll be the multidisciplinary clinical teams mobilised, you know, per issue, per patient. And then there'll be teams that are mobilised for crisis. And we're wondering, actually, here's a big question, to what extent people really take time to practice being a team. Bit of an insight. I mentioned earlier in the executive suite, with a number of army leaders providing mentoring for our leaders. And actually the army leaders spend their whole careers practicing. Yeah. They have noticed, in terms of the common themes that they pick up in their mentoring and their coaching discussions with our leaders, that probably knowing how to build a really effective team is quite low on our list of capabilities as leaders in the NHS. They think we're great in terms of reaction and crisis, but they think that we sort of do teams more intuitively than they typically would.
I think a number of our colleagues on this call, I think Elizabeth as well, has received some coaching from our, that was one of the offers that were available through the national offer, and big thumbs up there. Jacqueline, there's lots of things coming in, and I've seen that we might have some things through YouTube as well. Shall we move on to our next slide, which is asking about networks?
Yeah, thank you. So Helen, Bevan and I and the team were having a really good chat about this. We were sort of thinking, you know, typically when we launch things into the system, we do it all very formally, through all the formal routes, through all the formal agencies. And actually we're thinking one of the things that Wave 1 taught us is the life's not quite like that anymore. And we know that, for example, we've got a fantastic OD network across the NHS. We've got fantastic freedom to speak up guardians. We've got fantastic union reps. Where are these kind of formal, semi-formal, informal leaders around leadership in the service that we want to partner and collaborate with? Who are the people that could be our the nearest thing to our leadership lifeguards?
So if you could add these to the chat box and or email my colleague, Lindsay Ogilvie. Lindsay is the support behind all of these sessions that we have on a Wednesday. So if you want to email Lindsay or add to the chat box, what are all the networks, either local, regional or national networks, who we should be talking with to ensure that everybody, that's everybody across our health and care system, can hear about these offers and get some support. So please do add them to the chat box. And if you've got more information that you know sort of who's the best person for us to contact, then please do email Lindsay. And I'm going to ask for Lindsay's email address to be added to the chat box, so you can just pick it up and email Lindsay after the session as well. So that's on the networks. And we're going to have another session, aren't we, Jacqueline, just on this?
I think this is so important, Zoe. And typically in the world of leadership education, we will want to get things built well and to quality. And what I'm saying in the team here, actually, we've got to move fast. I will kind of give a little bit about quality in return for innovation and speed. I was, particularly taken by the story we heard, from Birmingham about, kind of the innovation that just kind of bubbled up there. How can we support that innovation?
So if you would like to come to a design event all about what we're sort of calling these leadership lifeguards, lifeboats. It's a working title, isn't it, at the moment, Jacqueline? But if you'd like to come, we would love to have you with us. So we've got a design event, 4th of November, 11 till 12. All the details will be on the Horizons website, where you got the details from today, and I can see them all being added to the chat box at the moment. So please do join us. And then our next community event will be the week after, which is Wednesday, the 11th of November. All the publicity for this will be on the Horizons website. It'll be on Twitter and through the usual links as well. Thanks, Jacqueline, for sharing with us.
You.
I've got a few more things to share with you today before we finish. So, Paul, please could we load this poll up? So I'd love to hear from you about to what extent has today's session been useful in your own role in supporting the health and well-being of others? And they're just coming in at the moment. So you can use the poll if you can see it in Zoom, and if you can't see it, then please do add it to the chat box in both YouTube and in Zoom as well. So we'll just take a few moments to see those coming in. Whatever your number and your comment, then please do add a comment to the chat box so we can find out a little bit more about what you do value from these sessions. So if we could close that for me, please, Paul. And we'll share those on the screen as well. Fantastic. Thanks, Paul. So a couple more events to tell you about. We have a finance, so we've started some finance webinars as well. There's a series of these, and you can find out about them through the Horizons website. So these are also run by the People Directorate. So we've got the next Finance, Health and Wellbeing conversation on Thursday the 15th, so tomorrow. And we've got lots of other sessions which are focusing on working parents, carers and families as well. So there's a number there on the screen. We'll also put the link in the chat box and put these on the Horizons website as well. So you've got good access to all of the webinars that are continuing at the moment. And also, I believe that there's an art pack as well. So those of you who do have children or caring responsibilities, there's a fantastic art pack which is connected with those webinars as well, which no doubt I will be downloading. So to conclude, thank you so much for joining us today. Here's the information for future sessions. We hope to see you then. Please do keep connecting with us on the Thrive platform, through the website, through Twitter, and we look forward to seeing you on 4th of November. I'm going to stop my sharing. Thank you, everybody.